belong with me, and I belong with you. You belong with me, and I belong with you.
So, hello and welcome to bite number 12 of our Mental Health Matters video chats, what we like to call Belonging Bite-Sized. And I'm Sophie Wood.
And I'm Danielle Wood. And today is our recap on the Mental Health Matters series. And we're going to take a look at what happens next. So, I don't know about you, Sophie, but I'm feeling a teensy little bit sad today. Again, because as we draw this to a close, this is our Mental Health Matters series of bite sizes finishing today. And I came into this series, I must admit, a much more confident person, a much more confident attitude than when we did the LGBTQIA+ series for Pride Month. So this time it's been more fun. I think it's been more joyful than last time, and I hope that comes across in some of our content. You know, what about you, Sophie?
Well, I really hope that one of the things that we've demonstrated without really meaning to is that you can actually talk about some really serious subjects, but actually still have joyful experience in engaging with that. So if that's the only takeaway, then I think that's a really good one for people. Personally, like you, yeah, I've really enjoyed it. I feel like we're starting to hit our stride a little bit, so that's quite a nice feeling. So, Danielle, what would you say are the key learnings from our sessions this time around, from your perspective?
Well, I think one of the key things from our first discussions was just about understanding mental health. You know, the key learning point, I think here is recognizing that mental health is just as important as physical health. And also it's essential to understand the components of mental health and distinguish between mental health and poor mental health or mental illness. And this awareness forms the foundation for all the other mental health initiatives, doesn't it?
Yeah, it absolutely does. And for me, I think reducing stigma around mental health was another crucial topic that we discussed. So we learned that having open conversations and good education around mental health are vital in breaking down these barriers that are traditionally associated with mental health. And this is what we term when we call it stigma. So creating an environment where employees feel safe to discuss their mental health without fear of judgment is absolutely key.
Yeah, I think another element that came out of the session was recognizing the signs and symptoms of mental health issues. And that in doing so, early identification can lead to early intervention, which does significantly improve outcomes. So noticing changes in behaviour, mood, or performance, and knowing that those are indicators, and training your employees and managers to spot these signs early, I think that's a really great thing as well.
That's right. And we also talked about creating a truly supportive environment. So the main takeaway here is the importance of fostering a workplace culture that prioritizes and promotes mental health. So this includes implementing policies and practices that promote mental well-being and ensuring that your leadership teams are actively involved in these efforts.
Yes, absolutely. And effective communication strategies are another important topic. I mean, we emphasise the importance of approaching conversations about mental health with empathy and active listening and using appropriate language around them. And also being supportive when somebody opens up about their mental health, which can make a huge difference to them.
Yeah, and another key learning point was that providing resources and support was absolutely key as well. So employers should ensure that employees have access to mental health resources, such as employee assistance programs, EAPs that we mentioned, and promote these resources regularly because that's key to reducing stigma around the use of those actual resources, if that makes sense.
It does, absolutely. And we also discussed the importance of mental health training, the benefits around, increased awareness, reducing that stigma that you mentioned, and better support for employees and managers. So implementing and sustaining these training programs does require ongoing commitment from the organisation. Also, we talked about managing and reducing workplace stress, which is another major focus, and techniques for managing stress, such as mindfulness, time management, and how they can be important. And organisational strategies like promoting work-life balance and creating a supportive culture are equally important.
That's right. And also, responding to mental health crises in the workplace was critical discussion as well, I think. And the key points there was the importance of identifying when a crisis is happening, taking immediate steps to ensure everybody's safety, including your own, providing support and reassurance to the individual concerned, and the importance of following up with post-crisis support. And having a plan in place for crisis situations is absolutely essential. But for me, I think promoting long-term well-being involves integrating mental health into overall wellness programs, and monitoring and evaluating initiatives is absolutely essential, as is creating a culture of continuous improvement. And it's that ongoing commitment helps to ensure that mental health remains a priority.
Yeah. So, what can businesses do next? Well, first, commit to prioritising mental health by integrating it into your organisational culture and policies. Provide that ongoing education and training, and ensure people have access to mental health resources. And then foster an environment where open conversations about mental health are encouraged.
That's right. And encourage leadership to lead by example, by showing their commitment to mental health. Regularly assess and adjust your mental health initiatives based on the feedback that you receive, and also based on the latest research. And remember, promoting mental health is an ongoing journey. It's continuous. It's not a one-time effort.
Yes, agreed. So there we go. We'd like to thank you for joining us throughout this series, and we hope that it has gone some way to raising awareness and helping those who listen. The whole series is now live on our website. That's www.belongingbase. It's along the bottom of the screen. So if you want to continue your journey with our content, then please do make sure you follow us on LinkedIn. We have our own personal profiles, but we also have a Belonging Base business page. So thank you for listening.
Yes, and I really hope that you've enjoyed it. And my last request to you is think about the positive impact you could make. Maybe share it with us in the post comments. But for now, sadly, it is goodbye.
Bye.
To answer for, 'cause you belong with me, and I belong with you. You belong with me.